Well, Dr. Corson, thank you so much for taking the time to talk to our audience about Lyme disease and tick-borne disease and other chronic illness. Our audience are probably not very familiar with this type of tick-borne disease and Lyme disease. And would you take a few minutes to explain to them what is Lyme disease?
Well, thank you very much, Dr. Young, for inviting me and having me on your show. Most people think of Lyme disease as an infection caused by the bacteria, which is a spirochete, a type of very complex bacteria called Borrelia burgdorferi. That's the scientific name of it. So they think of it as just that infection with that one particular bacteria. But actually, those of us that treat Lyme disease, and especially myself, we define Lyme disease as a constellation of multiple infectious agents that are generally vector-borne, meaning they come from the bites of blood-sucking insects, mainly ticks, although there are other modes of transmission. So patients I have found in my 20 years of treating Lyme disease really usually have 3 to 5 different infections that have come from these blood-sucking insects. So there are the Borrelia species, there are Babesia species. Babesia is a small unicellular parasite, which is a malaria-like organism, which comes from ticks. And there are a couple different species in North America. Then Bartonella is a bacteria that is found in ticks. It also is found in other animals. We'll talk about that later. There is human monocytic Ehrlichia, which Ehrlichia is a small bacteria that lives inside of cells. And the reason it's called human monocytic Ehrlichia is because it preferentially infects a type of white blood cell called the monocyte. And then there's also human granulocytic anaplasmosis. Anaplasma is another small bacteria that likes to infect human granulocytes, a different kind of white blood cell. There are relapsing fever Borrelias, which is a whole different class of the spirochete, the Borrelia burgdorferi, and other species of Borrelia that are in ticks. There's something called Q fever, which is another bacteria. There's Rocky Mountain spotted fever, which is not isolated to the Rocky Mountains, but is all over the country. There's another bacteria called tularemia, which was first known in medicine as a disease that people would get from skinning rabbits. It was transmitted from rabbits to human. And there are viruses in ticks. There are all kinds of things like nematodes, which are small little parasites. So there are all kinds of infections, agents in ticks. I always used to say in my lectures that, ticks are cesspools of disease because they have a tremendous number of infectious microorganisms in their gastrointestinal tracts. So that to me is what Lyme disease is. Lyme disease is a polymicrobial, or meaning many different kinds of infectious agents causing an illness. I found that in my practice, 80% of my patients are co-infected with more than one infection. As I said, the average is anywhere from 3 to 5. The co-infections, unfortunately, are really best diagnosed clinically. And people who are co-infected with multiple organisms are sicker. They're more likely to have failed treatment in the past. They require longer treatment with multiple agents to try to help them. And the co-infections really have to be eradicated if you really want to get rid of the Borrelia, which most people think of as Lyme disease.
Wow, that sounds very, very complicated. So how common this Lyme disease or the co-infections of Lyme disease in the country and in the world?
I think it's actually quite common, especially in the northeast of Pennsylvania and northeastern of the United States, not just Pennsylvania. It's really all of Pennsylvania. I'm in the southeastern Pennsylvania, part of Pennsylvania. But in areas where there are ticks, there are a large, not all ticks are infected, but a large percentage are. One thing that's happened in our environment is that in 1900, there were hardly any deer. There were very few deer, and the deer population has gone up exponentially. And deer's populations have increased in suburbia where there's no hunting pressure. So we have a tremendous number of deer, and with the deer come deer ticks. And then with the sort of habitat in suburbia, you have some of the other small animals that will transmit some of the other tick species. So I think that It's quite common, especially in areas where there are a lot of deer and therefore a lot of ticks. And that's really in, large areas of Europe, Asia, North America. And then there are different tick species in different parts of the world. There are different tick species in Europe than there are in the United States. And then there are ticks in South America, of course. So anywhere where there are blood-sucking insects, some of these infections can be problematic. I can't give you an absolute percentage because no one's ever done that study and taken blood from 1,000 people at random on the street to see whether they have antibodies to any of these infections or not. I don't think it's ever been done.
So how do people know they are infected in the first place?
Well, let's talk about how these infections are spread and how they infect people, and then what the symptoms are like. That's how people will get an understanding. Most of these infections, again, generally come from tick bites, as the infectious agents are inside the ticks. Well, how does a tick bite? What is a tick bite? Well, the tick has these long serrated mouth parts that as it crawls and gets onto you, it then finds a spot and it digs into the skin. It also releases chemicals from its saliva that numb you so you don't feel it, give anti-inflammatories off, which reduces the host's immune system in the area to the foreign thing that's come in. And it also, they secrete things that will make your blood less likely to clot so that they can actually have blood and drink blood. Then they also secrete a cement-like substance in this area where they bite that acts like a cement plug to hold the mouth parts into the skin. So it's difficult to pull them off. Anyone who's pulled a tick off knows that you have to be careful and slow, steady pressure in order to have that head and the mouth parts and the plug come out. Otherwise, you could rip the head off and leave the parts inside, which isn't a good idea. So once they create that plug, then they start sucking blood. And while they're sucking blood, they like to vomit their gut contents into the wound. That's how they then transmit the infectious agents into the host.
Wow.
There are a few of the agents that can be in the saliva. So in the salivary glands, they can, give them to the host as they're putting saliva in. But generally, they vomit their gut contents into the wound. So that's how the ticks bite, hold on, suck blood, and transmit infections. Now, it is possible that there are other biting or blood-sucking insects that also transmit some of these infections, such as mosquitoes and fleas. Fleas have been known to transmit Bartonella, a bacteria. Mosquitoes, of course, are known in many parts of the tropical world to transmit malaria. But I have had patients tell me that a rash characteristic of Borrelia infection, which we'll talk about, actually came at the site of a mosquito bite. So there are other vectors. Now, unfortunately, there's also sexual transmission of Borrelia. That's been documented. And there has also been documented transmission of several of these infections from the mother to the child as the child grows in utero or inside the uterus. And Borrelia has also been found in semen, and it's also been found in breast milk. So there may be other ways of transmission that are significant in the population, but that aren't generally accepted. Bartonella, another bacteria, as I talked about, at one time in a study in ticks in New Jersey, more ticks had Bartonella in them than did the Borrelia. So it's actually quite common from tick bites, but it can also be acquired from exposure to the saliva or bodily fluids or being scratched by many different animals, such as cats, guinea pigs, horses, dogs, ferrets. A lot of veterinarians have, Bartonella infection. So that's how you get these things and how they can spread to people. So what are the onset of the symptoms like? Well, you can get sick very quickly after a tick bite, or you can take any, weeks or months to develop an illness after a tick bite. It depends upon what infectious agents you got. And there may or may not be what's called an EM rash, erythema migrans. Erythema means red. A red rash, and then the migrans mean that it moves, because the EM rashes from tick bites tend to start one size and they get bigger and bigger and bigger and bigger. They also do not have to have the classic bullseye where the center clears. They can be highly variable in appearance. And I've had patients who had gone to the doctor with a rash after a tick bite and said, I think I had Lyme disease. And the doctor said, no, it's not a bullseye. Well, it doesn't have to be an actual real bullseye. So the presence of that EM rash is enough to make a diagnosis of Borrelia infection, because that is Borrelia in the tissue spreading. Okay. So that spreading rash represents the growth and the spread of that particular organism. If the spirochete, then the bacteria, the Lyme bacteria, enters the lymphatic system or the bloodstream, then it can spread throughout the entire body and infect any organ or tissue. Sometimes after a tick bite, you'll get more of a sort of a crater or an ulcer with a lot of redness around it. That is often an Ehrlichia or an anaplasma infection. Unfortunately, less than half the people who have documented Lyme disease even remember a tick bite, and even less than the percentage of the ones that actually remember a tick bite ever saw an EM rash. So you can't say, well, I didn't have Lyme disease because I never got an EM rash. Well, that's just not accurate. Now, if you have a tick bite, maybe you didn't see it. A lot of people don't see the tick bite because, as I said, they inject these substances that numb you and reduce inflammation in the area. So sometimes you don't even know you had a bite. If the organisms that are coming out of the tick get into your body and bloodstream and lymphatic system, you normally get something that looks like a flu-like illness. You can get fever, headache, stiff neck, muscle aches and pains. You can be confused mentally. You can have joint pain, stomach pain, fatigue, night sweats. Those are characteristic initial symptoms of a first infection. That flu-like illness can be short-lived, a couple hours, or can last several days, and it usually disappears spontaneously. So some people think they just got a summer cold or a summer flu or even a winter flu. Ticks can be active almost year-round. If they're out in the sun, even 28-degree weather, if they're in direct sunlight, they can become mobile. So just because it's cold and it's November or it's February, if it ever gets above freezing and in the sunshine, you still have risk for tick bites. If Lyme is not suspected, because you think it's just a summer cold or a flu, then the infection spreads deeper into the body. It sort of sinks into the body and can go deep into the organs, into the tissues, and become very chronic. So the kind of symptoms that you see once the disease has become deep in the body, penetrated into the organs and tissues, into the nervous system, you can still have intermittent flu-like illnesses, fatigue. Often the fatigue can be overwhelming and unrelieved by resting. You can have cyclical fevers, or fevers come off and on, headaches, Bell's palsy, or weakness of half the face with the face drooping, is also characteristic of Lyme. You can have all of a sudden frequent infections all the time. Say you got Lyme disease in the fall, you didn't really realize it, you thought you just had a cold, and then that winter you get bronchitis, you get ear infections, you get throat infections, you get bladder infections. All these different infections come that normally you wouldn't have. That's because Lyme suppresses the immune system. Another symptom can be swollen glands that come and go in the armpit or the neck, sometimes in the groin. That's more like Bartonella. You can have recurrent sore throats, all kinds of shortness of breath, dry cough, chest pains. New onset atrial fibrillation, which is an irregular heartbeat, often is, especially in a young person, can be the presenting symptom of Lyme. People have stomach pains of all kinds. They have changes in their appetite, irritable bowel-like symptoms. They have change in how they stool or how they move their bowels can change. They can all of a sudden have diarrhea, or they can become constipated. They can have joint pains. Typical of Borrelia is joint pains that come and go. They're migratory. One day it's your shoulder, the next day it's your elbow, the next day it's your knee. They're intermittent and migratory. So they come and go and they change position. That kind of joint pain is very typical for Lyme. Also, people have arthritis. You get moving, motion is lotion. Their joints get better and better as they move if they just have arthritis. But a Lyme joint will start to hurt more and more and more the more you use it. People can have deep bone pain, muscle aches and pains, have muscle spasms. They can have twitches of little muscles where the little muscle kind of just goes on by itself. They can have trouble with their bladder where they feel like they have to go to the bathroom all the time. We call it urgency, frequency. And then they can have pain, and they can even lose their, wet their pants or become incontinent. when you examine these people, they can have all kinds of different rashes that come and go. They can have new onset neurological and or psychiatric symptoms. And that's a very big thing. And I would like to touch on that a little later. All kinds of sleep disturbances. When the central nervous system is irritated and infected, you just don't sleep well. Then a lot of people can't exercise anymore. Say they used to be able to run or bike, and now they just can't exercise. They have what we call reduced aerobic exercise tolerance. They can't tolerate exercise. When they exercise, they feel horrible. They feel sick. Sometimes they get real dark circles under their eyes, and it's not just like allergy shiners, but they're actually, because of the effects on their body. And you, as a Chinese medicine doctor, would understand the implications of that better than me. Often these people have dramatically increased allergies and also chemical sensitivities. For instance, they can't stand perfume fragrances they used to enjoy, or they have much worse seasonal allergies. So those are the kinds of chronic symptoms that people can have. I probably missed multiple ones, but those are the ones that sort of came to me right away. And it's very important to remember that less than half of the people with Lyme disease ever remember a tick bite, and even less remember an EM rash. And again, the EM rashes are really highly variable in appearance.
Yeah, well, sounds like when you become chronically ill with Lyme or tick-borne disease, it's almost impossible to diagnose them because they mimic so many different kinds of illness diseases, right? So what has been your patient's experience with chronic Lyme disease when they visit different specialists, that didn't remember the tick bite or didn't have a rash that typically would have? What happens to them?
Well, they usually are told that they have chronic fatigue, they have fibromyalgia, or they have multiple sclerosis, or they have Parkinson's disease, or they have dementia, or they have some sort of allergic problem, or some sort of chronic skin condition. They're told they're psychiatrically ill. So many of these things happen. And patients that I see that have been really sick for a long time, sometimes they've been to see anywhere from 10 to 30 doctors, and not one of them has diagnosed it properly. So one of the reasons is that, blood testing is really unreliable in this illness because the antibody production against pieces of the bacteria are really highly variable. When people have an initial illness and they think it could be Lyme, often they go to the doctors draw a blood test for antibodies right away and say, oh, well, it's negative, so you don't have Lyme. But that's not accurate because it takes several weeks to develop the antibodies. So if you have a new infection, you may have no antibodies at all. It may take 6 weeks or so. So by that time, the infection spread throughout your whole body. So it's important to treat it early. So a positive test, if you have antibodies, is helpful because that shows that the body has indeed seen this organism, has made antibodies against it. But a negative test should never, ever be used to say you do not have Lyme disease. So negative test does not rule out the presence of the illness. It's a clinical diagnosis, and it's made by a doctor who takes an adequate and accurate history and does a comprehensive physical examination. Because if you take a good history and you really take a good look at their body, then you'll be able to understand what the problem is.
I can understand that the antibody may not develop in the acute stage of the illness. What happens to those people who have chronic symptoms and do not have antibodies? Is that still possible they have Lyme disease?
Yes. The reason is that Borrelia burgdorferi, the organism that we talk about as Lyme disease, although, of course, there are many other co-infections as well, is an incredibly sophisticated organism that is really good at evading immune system detection. And it also is very good at hiding and confusing our immune system. It short circuits part of our immune system. And it is very good at, sequestering itself in biofilms and stopping the immune system from actually attacking it. So often the sickest people don't have any antibody production until you start to treat them and you try to help them and you start to build up their vitality. And then sometimes you'll see antibodies all of a sudden light up like a Christmas tree. But some of the very sickest chronic Lyme patients don't make any antibody because of the way the organism affects and damages our own immune system function.
So let's go back to the acutely infected people. And let's say they had acute symptoms, they recognize they just had a tick bite, they got tested, even though negative, but they've been diagnosed with Lyme disease. What do they expect to be treated?
It really depends upon whether you're ill and you have active sickness or whether you think you were exposed because you had a tick bite. So the first kind of questions I ask when people call up in a panic saying that they had a tick bite, I say, well, number one, what kind of tick was it? Was it attached? Was it hard to pull off? Was there that white cement plug around the mouth parts? Did you leave any of the parts in? Had the tick started to engorge, which is the process of getting bigger as it sucks blood? Has there been any reaction at the bite site? Is it red? Is it itchy? Is it sore? Is there any kind of ulcer-like thing? So that's helpful. If people think they were exposed just because they had a tick bite and they don't seem to have many symptoms, then I think they should send the tick for evaluation. There are several labs that do that, but one here in Pennsylvania, up in Strasbourg University, is at tickcheck.com. So that's tickcheck.com. And their turnaround time is about 30 hours. So you can get that pretty quickly. And what they do is they look at the contents of the gut of the tick. And well, they grind the tick up and then look for the genetic sequences of the different organisms, and they'll tell you, did it have Borrelia? Did it have Babesia? Did it have Bartonella? Did it have Ehrlichia? Did it have Anaplasma? Did it have Rocky Mountain Spotted Fever? So they'll tell you, and there are different tests that you can, panels that you can ask. It's not terribly expensive at all. So that's very helpful, because why would you want to put yourself through a treatment if the tick was completely clean? So I always ask people to try to remember to keep the tick, put it in a plastic bag with a little bit of a moist cotton ball or a moist paper towel, put it in the refrigerator, and then send it off to be checked. For acute tick bites, when it's within the first day of the bite, I use a homeopathic medicine called Lyme Disease at a 1 m or 1 million dilution. What it does is it helps the immune system push out the infectious agents in the foreign bodies that aren't self, that are at that bite site. So Lyme has been traditionally used for any kind of puncture wound, anything that punctures through the skin. The Lyme Disease is used in homeopathy to help clear whatever toxins or infections or dirt or grit is in that. So it kind of wakes up the immune system function right at that spot where the bite is, where the entry into the body is, and then pushes it out. And I have people continue that until the bite site's healed. That could be 3 days, that could be 7 days, it could be 10 days. Then if anyone develops any really suspicious symptoms, then they must get treatment, and must get treatment as soon as possible. Because if caught early, Lyme disease can be cured. But if these infections are not treated early and they spread deep into the body, they can become chronic and very difficult to eradicate. So if you're actively ill after a tick bite, generally most doctors will use regular allopathic antibiotics, meaning regular Western pharmaceutical medicine. I would suggest that in the event of an acute bite where you're ill, I would take both a cell wall antibiotic, which would be either a penicillin derivative like amoxicillin, or a cephalosporin like cefuroxime or Ceftin or Suprax or brand names, as well as a second intracellular antibiotic. And the best really is doxycycline, because doxycycline will kill the Anaplasma, the Ehrlichia, and the Rocky Mountain Spotted Fever. So the combination of 2 antibiotics, if you're ill, for at least 4 to 6 weeks. And the reason it's that long is because the life cycle of Borrelia burgdorferi is at least 4 weeks, sometimes longer. So that means that it takes 4 to 6 weeks to actually kill all of the organisms that are there, because they can only be killed as they're actively growing, the way the antibiotics work. Taking 10 days of doxycycline, 100 milligrams twice a day, is totally inadequate, and drives the Borrelia deeper into the body, making it very hard to get rid of. That was shown by Eva Sappi from the University of New Haven in vitro, meaning in the laboratory in culture cell culture studies showing that doxycycline caused the Borrelia to just like curl up in a ball and make this biofilm and just hide, and only killed a small percentage of the actual organisms. And then those become much harder to treat. If possible, it's better to use a higher dose of doxycycline, to use 200 milligrams twice a day. Now, in the summertime, that's tough because you get sun sensitivity, and you can get very severely burned from having doxycycline in the skin in the summertime. But it's really advisable to do at least 2 antibiotics. Now, that's for what most people will get from their doctor if they can talk their doctor into it. But you can also go to 2 websites to try to help find a doctor that can treat you. One of them is ilads.org, ilads.org, which is the International Lyme and Associated Diseases Society. The other one is LymeDiseaseAssociation.org, LymeDiseaseAssociation.org. They can give you a lot of information about, deal with tick bites, how to keep yourself from getting tick bites, how to protect yourself in your yard, how to protect yourself with clothing when you go out into areas that are full of ticks, and can also, help you find a treating doctor, a doctor who's called, quote, Lyme literate, who knows how to treat these infections near you. For myself in my own practice, I tend to use herbal antimicrobials, and these are individually chosen depending upon each patient's symptoms. So I can't really make generalized recommendations. But there are many times I also use allopathic antibiotics, especially in acute cases where somebody has a fresh infection and they're acutely ill.
Okay, sounds like the early treatment is critical before,
Yes, it is.
to prevent the illness developing to deep organs and all that. And so I think this is a very important information because a lot of doctors today, they don't recognize the importance of treating the Lyme disease. So not only with sufficient amount of dosage and a combination of medications, but also long enough, like 4 to 6 weeks that you're doing.
Correct.
Yeah.
So, if untreated, what happens is these very complex infections and these complex organisms get very deeply seated in the body and in the central nervous system of the brain. And you can get a lot of chronic degenerative diseases, as I said, like arthritis or autoimmune disease, chronic fatigue, fibromyalgia, dementia, and others. The immune system in these people becomes dysfunctional and confused. And it not only allows for the persistence of the tick-borne infections, but also allows for the resurgence or the resurfacing of previously acquired community infections that we all get, like Epstein-Barr virus, which is mononucleosis, herpes viruses like the cold sores, mycoplasma infections, a lot of things that we all are exposed to in our life, and we normally, are able to lock away and keep under lock and key, come out to play again because of the damage to our immune system function. And the other thing that most doctors don't have a real understanding is that the symptoms of chronic Lyme disease can very often be neurological and psychiatric. For instance, a child may get a tick bite when they're 5 years old, and all of a sudden at the age of 11, they start to develop an anxiety disorder or obsessive compulsive disorder or something like that, and people would never connect it to the tick bite that they had when they were 5. So they can happen, months to years after the bite. And things that will clue you in that there could be a possibility would be if there is indeed any history of tick bite. That always makes you very suspicious because remember, less than half of the people even remember a tick bite. There's a deterioration in mental function. All of a sudden, children don't do their schoolwork well anymore. They lose IQ points. People don't do well at work anymore. They can't concentrate. They can't attend. They become diagnosed with ADD or ADHD. People have trouble remembering words or names. They can't remember what they walked into a room for to get. They can't understand what they read. They lose math skills. They lose musical skills. They use sports skills. They get all kinds of headaches. They become sensitive to noise, light, odors, touch. They develop problems with their balance and coordination. They can develop all kinds of movement disorders and ticks are like a motion or a repetitive movement that is not voluntary, it's involuntary. You can have all kinds of problems with your eyes, where your eyes don't track and read right, and skipping words or skipping lines. And you can even get problems with nerve roots that are infected and then have horrible, painful problems down a nerve root, like it's called Bainwarth syndrome. It's been known for a long time in the European literature. Again, you can have Bell's palsy, but you can also have a problem with the eye nerve, the optic nerve, and have what we call optic neuritis, and your vision can be affected. You can have hearing problems, the eighth cranial nerve. You can have swallowing difficulties, and you can even develop seizure problems. The most common psychiatric symptoms are uncharacteristic behavior outbursts, mood swings, irritability, emotional lability. Somebody starts to get teary for no reason, or for a situation that wouldn't necessarily make somebody cry. They can withdraw socially. They can have decreased participation in activities because they, just are dull. They just are cognitively compromised. They can be depressed. Suicidal thoughts. Suicide is not uncommon in patients with untreated chronic tick-borne disease. Rage and anger management problems and anxiety and panic attacks are actually quite common in this group. That feeling of depersonalization, not being able to tolerate frustration, not being able to tolerate losing, having to always be in control, obsessive compulsive disorders. I've even had patients have all kinds of hallucinations, personality changes, psychosis, and even self-mutilating behaviors. So these are all psychiatric symptoms that, if they're new onset of an anxiety and panic disorder in a 50-year-old man who has no history of any kind of psychiatric illness, is a tick-borne disease until proven otherwise. And then the patient I'm thinking of, it was Babesia as well as Borrelia. Children and adolescents who have these rage and these, anger and anxiety and panic and self-mutilating behaviors, almost all have had Bartonella in addition to other infections. So these symptoms can really give you a clue.
When people have been infected and some of them will never become chronic and some of them will become chronic. So what made a difference? What kind of factors involved that make some group of people more vulnerable to become chronic than others?
That's exactly correct. That's an excellent question. About a quarter of the people who get Lyme become chronically ill. About a quarter of the population of the world tends to develop chronic illness when they're exposed to certain biological toxins that can come from the Borrelia, the Babesia, we think the Bartonella, as well as things like mold that's growing in their homes or in their offices. Okay. These are the people that have a genetic predisposition to have a state of inflammation chronically when they have these kinds of infections and toxic exposures. These are the quarter of the population of the world that tend to have problems. You're right, there's some people who get a tick bite, they get sick, you sprinkle a little antibiotics on them and they perk right up and they're fine and they don't develop any problems, where others would get very chronically ill. And I believe it also, in addition to their genetic makeup, has to do with the epigenetic factors, or the factors that control how their genetics is expressed. These can include their nutritional status, their emotional status, their history of physical or psychiatric trauma, as well as other toxins that are involved. For instance, heavy metal toxicity from a mouthful of metal amalgams, or growing up in a house with lead-based heat, or eating a lot of food that's contaminated with cadmium or other things. Also, people who tend to ingest a lot of the environmental toxin glyphosate, which is the main ingredient in Roundup, which is used in, so freely in this country in our agriculture. All of our processed foods and, our wheat is sprayed with it, oats are sprayed with it. A lot of the corn and the soybean has it, it's Roundup ready. It's already got those chemicals in the plant and genetically modified plants. So a lot of people ingest that in their diet, in their air and their water. It's ubiquitous now. So these other factors can contribute to someone getting more chronically ill than others. So it's really, your genetics as well as your lifestyle, your life experiences, your diet, your emotional situation, someone who is has a history of emotional, physical, or sexual abuse is going to be much more prone to develop chronic problems than someone who hasn't had any kind of those problems. So yes, there are many factors that contribute to why some people get sick and others don't.
Not only the infection of a Lyme and the co-infections of Lyme disease, there seem to be other types of bacteria, virus, even vaccines that can generate similar symptoms like chronic Lyme disease in certain population. What would be your comment on that?
Well, that's part of the differential diagnosis workup when you see a new patient that you suspect has Lyme. Just because it walks, talks, and squawks like it's Lyme disease doesn't mean it is Lyme disease. You need to also do a good medical workup to make sure that you're finding all of the problems that the patient may have. You could have autoimmune disease. You could have autoimmune thyroid disease. You could have intoxicants like heavy metals that are problematic, or as I said, the environmental toxins. You could have mold exposure, and you need to check for that. So yes, there are other infections, community-acquired infections. Epstein-Barr is a big one. Problem is that many of these things coexist in the same patient. So another problem that people have is they tend to get hypercoagulable, meaning that their blood is too thick and sticky and like molasses rather than water, and it tends to clot. And there are many reasons that this happens, but chronic infection and toxicity is one of them. So these patients who are chronically ill usually have multiple factors that you have to address not just the infections. And a lot of the people that come to me over the years have seen other Lyme literate doctors who have just focused on the infections and just treated the infections over and over and over again with antibiotics and didn't deal with the fact, that the patient's got a mouthful of metal amalgams and is mercury toxic, or the patient is living in a moldy house, or the patient has, serious gut dysbiosis, which is abnormal growth of bad bacteria in the gut that has to be dealt with, or they're horribly hypercoagulable and you need to deal with that because they may have a genetic predisposition to develop hypercoagulability when they're stressed. So there are many factors that create that common problem of the chronic disease. And yes, you could say, well, this symptom and this symptom are characteristic of this particular infectious organism, but it's also characteristic of this other one. And then it's also characteristic of this kind of toxicity. So that's why you have to really evaluate these patients very carefully and go through all of those variables and try to address all those variables at once. It's kind of like, peeling an onion. You've got to slowly get down to the core where it's fresh. And every once in a while, you'll find a rotten spot and you got to work there for a while to clean that up. And it's, going down deep into the body and pulling these trapped toxins and infections up out of the body and bringing them to the surface so you can clear them. And that's kind of it's the art and it's the fun of it.
It also sounds a very long process of healing to accomplish all that. How do you help patients to being that patient and to follow through the treatments? And I know in the process of treatments, they can have a lot of fluctuations of symptoms. Sometimes they get worse before they get better.
Yeah, well, the more experience I have with it, the less bumpy that road is. And if people are compliant with what I ask them to do, if they are compliant with the lifestyle changes that they need to make, meaning they've got to clean up their diet, they need to get out of mold or remediate where they are so that it's clear of mold, and they need to do different lifestyle changes and stop drinking alcohol, stop smoking cigarettes, get good sleep, again, eat a really healthy diet. If they do all these things and they follow their protocols as prescribed, then really sick people can really be a whole lot better in about 18 months. They may not be done, but they're significantly better. And it's my job to teach patients what they need to do to keep themselves healthy once they've gotten there. So I use a whole, combination of herbal antimicrobials and herbal combination medicines to help clean up their organ function, to reduce inflammation, to treat their hypercoagulability, to detoxify their liver, to help with their kidney and lymphatic function, to help their endocrine problems, their brain fog. So as you do all these things all at once, then people can really get a whole lot better. But I always tell my folks, you've got your own responsibilities and I've got my responsibilities, and we'll walk the road together. I'm not going to pull you along, but because, you've got responsibilities. So if you're able to do that, then we'll get you better.
Well, you do sometimes refer patients for acupuncture treatments. And what is your thoughts on that? Why do you do that?
Because I think that acupuncture can be extremely helpful in chronically ill Lyme patients, because it helps to restore vitality. It helps to clear blocked energy channels. It facilitates immune system function. It helps to regulate the organs and help the organs clean themselves. And it really helps to remove the pathogens, find where the trapped pathogens are and remove them. And the Chinese herbal formulas that are often used in conjunction with acupuncture are, the concept of them is similar to what I do with the remedies that I've learned how to use in my own healing. Some of them come from the Chinese tradition, some come from the European tradition, some from the Polynesian tradition, some from the South American tradition. So I've learned how to use a combination of things that work in a similar way. They help to replete vital energy. They help to reinstate communication throughout the body. They help with the elimination of toxins. They reduce immune system confusion and aid in the destruction of pathogens, in an attempt to restore balance to all of the systems of the body. Once you restore balance and get out of the body's way, the body heals itself, because we have this incredibly divinely inspired, vessel that we live in for this life, which has an incredible ability to heal itself. We just sort of have to help it and nudge it along the way, and then get out of the way and watch it go.
How do people find you for consultation, or, if they want to learn more about Lyme disease or want to be assessed or evaluated or treated?
Well, again, the two websites that I gave you are wonderful ones for getting information about Lyme disease. The ilads.org, ilads.org, as well as LymeDiseaseAssociation.org. My practice is in Center City, Philadelphia. I see new patients. Right now, I'm scheduling new patients toward the middle to the end of September. So if they call the office and leave their information, then I call them back and decide whether, we both think it's a good fit for them. And then if they want to see me, then, we schedule an appointment to do that.
Great. Tell us a little bit about yourself. How did you get into the field? Because this is a very difficult population to treat. And how come you took on that challenge?
When my son was 11 or 12 years old, I remember one night he came down and he had an engorged deer tick in his ear. And I removed it, and he didn't have any other symptoms at the time. And I looked at what the American Academy of Family Practice, I'm a family practitioner, said, and it said, watchful waiting. And unfortunately, that was one of the worst mistakes I ever made, because gradually over the next 2 years, he became very seriously ill. And there were many other factors involved in that illness. And I've learned to treat my patients in a really holistic way as a result of my own child's illness. So I was working, trying to figure out what was wrong with him. And I was at a myofascial massage therapist appointment one day, and I was complaining about how sick my son was, and I couldn't figure it out. And the therapist turned to me and he said, "And he's got Lyme disease." I said, "Well, how can he have Lyme disease? I've done the ELISA twice. It's negative," which is one of the tests that you do. And he handed me this flyer of Dr. Joseph Burrascano was coming down to speak at the Unionville High School on the 8th of May, 2003. And so I went to this lecture he was giving to the community about Lyme disease. And I was so amazed. I mean, I learned more in that lecture to the community than I had learned in the last 10 years of practicing medicine. It was just unbelievable. And I took the little booklet that it handed out with all the symptoms, And I checked off what I thought he had. And then I picked my son up from school the next day and I said, okay, you fill this out. And he ended up having a whole lot more symptoms than I had. So I said, oh my goodness, you've got Lyme disease. So that started, and I started to treat him. So the lecture I heard was in May, and I tried to contact him. And in July, I went up for a week to observe in his office to learn what he was doing and try to understand how to treat tick-borne diseases. And then I came home after that, and within a few weeks, on July 22nd, 2003, I opened my own Lyme practice. Then I went back to study with him in September for another week. And then about 14 months later, I went to study with Dr. Charles Ray Jones, who was a pediatrician in Connecticut, who was the only pediatrician in the country that was actually treating pediatric Lyme disease. So then I started lecturing. I was asked to lecture about pediatric Lyme disease. And then I started lecturing multiple times a year all over the place. And I think I've lectured about Lyme disease and chronic illness in North America, Canada, Europe, and to all kinds of audiences, a lot of doctors' meetings and whatnot. So that's how I figured this out, is because my own son was sick. Nobody could help me. They told me it was all in his head, and it certainly wasn't in his head. So in 2003, I learned about tick-borne disease. And then in 2004, we found out that we were living in a moldy house. So I learned about treating mold illness and the problems with mold illness. And then in 2005, one of my patients brought to my attention a company that sold spagyric homeopathics, which is a special type of homeopathic. And I started learning from the naturopaths and the chiropractors that were teaching for this company. And I learned about hypercoagulability in 2005. And then I learned a whole lot more about naturopathic medicine, about nutrition, and about all kinds of herbal medicines. I'd always had an interest in herbal medicines and, grew a lot of herbs in my garden. But it was just such a wonderful, eye-opening experience. And it's so satisfying when people get better and people's bodies improve and their lives improve. And, the kids are able to go back to school and they're able to start doing their sports again, and they, get good grades again. I mean, it's just been incredibly rewarding to treat these patients. It's difficult. A lot of them are really sick, and the most difficult patients are the one that won't make the changes to get better. The ones that are sort of like that negative energy black hole that try to suck you down with them. And those kind of people, if they don't make changes, they're not going to get better. But so that's in brief, my story. It really started because of my own child's illness.
Thank you so much for a touching story. And are there any other doctor in the country to treat children and adolescents for their Lyme disease?
There are a growing number of doctors who are comfortable with that. And that's been one wonderful thing to see over the last, 5 to 10 years, is there are more and more doctors who are coming to understand it, because most of us got into it because of a personal reason. Either their spouse was sick, their child was sick, their parent was sick, they were sick, and they came to have this understanding and awakening about the problems. And so as more and more people are sick, then, doctors who become sick or become a family member becomes sick, then they understand it more. I've been also trying to teach other doctors how to treat pregnancy, because I've always felt comfortable treating women who have Lyme disease, during pregnancy and helping with their infants after birth and as they grow. So we need more doctors to treat pregnant people.
Great. Well, thank you so much, Dr. Corson. I know you're not just a Lyme specialist, you're also expert in managing and treating other forms of chronic illnesses. So I hope to have you come back to the show and talk about all that and share your experience with our audience.
Well, thank you very much. It was a pleasure being here with you this evening.